Hello, dear students. Welcome you all to one more beautiful session on neurology that is related to the seizure versus epilepsy versus convulsion. Myself, Mr. Nagaraj, your NORCET mentor and guide. Here I am in front of you to discuss the very important differences between the seizure versus epilepsy versus convulsion, and I am explaining in detail related to the theory which is very helpful for your competitive examinations. So first we will discussing the differences. What is the difference between the seizure, epilepsy, convulsion? Is this all three words are same? No, all three words are different. So students, we are discussing those differences between the seizures versus epilepsy versus convulsion, and we will study in detail all the types of the seizures, that is the of partial seizure or focal seizure, and the very importantly our generalized tonic-clonic seizures or the general seizure. So we will study each and every part in detail, students. That is very important for your upcoming nimhans and your NORCET exams. So if you are new to the video, please do subscribe to the channel, so you will be getting the more notifications related to my upcoming videos. And without wasting this time, so we will start our class here. Okay, so students, there is no any substitute for the hard work. This is the one standard beautiful motivational quote for you all. Students, you have to work hard, then only you will get your success. So there is no any substitutes, there is no any shortcut. ನಿಮ್ಗೆ ಒಂದು ರಾಜ್ಯನ ಅರಮನೆಗೆ ಹೋಗ್ಬೇಕಂದ್ರೆ ನಿಮ್ಗೆ ರಾಜ ಹೆದ್ದಾರಿಂದಾನೇ ಹೋಗ್ಬೇಕು ಹೊರತು ಒಂದು ಕಾಲ್ದಾರಿಂದ ಹೋದ್ರೆ ನೀವು ರಾಜನ ಅರಮನೆಗೆ ಹೋಗಕ್ ಆಗಲ್ಲ. ಸೊ ಅರಮನೆ ಬೇಕು ಅಂದ್ರೆ ನಿಮ್ಗೆ ರಾಜಮಾರ್ಗನೇ ಹಿಡಿಬೇಕು. ರಾಜಮಾರ್ಗ ಯಾವುದು, ಒಂದು ಯಾವುದೇ ಫೀಲ್ಡ್ ಅಲ್ಲಿ ಸಕ್ಸಸ್ ಸಿಗಬೇಕಾದ್ರೆ ರಾಜಮಾರ್ಗನೇ ಒಂದು ಹಾರ್ಡ್ ವರ್ಕ್. ಸೊ ಇಫ್ ಯು ಆರ್ ಡೂಯಿಂಗ್ ದ ಹಾರ್ಡ್ ವರ್ಕ್ ಮೀನ್ಸ್ ದೇರ್ ಡೆಫಿನೆಟ್ಲಿ ವಿಲ್ ಬಿ ಗೆಟಿಂಗ್ ದ ಸಕ್ಸಸ್. ಸೊ ಬಿಲೀವ್ ಇನ್ ದ ಹಾರ್ಡ್ ವರ್ಕ್, ಸೊ ನಾಟ್ ಬಿಲೀವ್ ಇನ್ ಎನಿ ಲಕ್. ಅಂಡ್ so that is very important for you all. So without wasting the time, we'll start. Okay, today's class. So students, let me tell what is the seizure first. After seizure we will see epilepsy and convulsion, and after seeing all three definitions we will differentiate all these three. What is the seizure, epilepsy and convulsion? See, so seizure is, see, this is your brain. Yes, the beautiful structure of the brain. Okay, so in this particular brain, from this particular point, abnormal electrical activities are discharging. So this abnormal electrical activity in the form of paroxysmal and hypersynchronous. What is the paroxysmal? Paroxysmal in the sense, the simple word paroxysmal means in on and off manner. Okay, means it's coming and going, coming and going. That is what we call paroxysmal, and it is an hypersynchronous discharge. See, normally our neurons that is present in our brain, synchronous means they usually releases the electrical activity, but hypersynchronous means here which is uncontrolled and abnormally high. Okay, uncontrolled and abnormally high, abnormal and uncontrolled release of electrical activities that may leads to the seizure. So what is the seizure? Seizure is a paroxysmal hypersynchronous discharge of an abnormal electrical activity in your brain. That is we call the seizure. Okay, ಸೊ ನೀವು ಮೂವಿಯಲ್ಲಿ ನೋಡಿರ್ಬೋದು, ಸೀಸರ್ ಅಲ್ಲಿ ಪೇಷಂಟ್ ಗೆ ಸೀಸರ್ ಬಂದಾಗ ಬಾಯಿಂದ ಸೊ ಸಲೈವ ಬರುತ್ತೆ. ಸೊ ಪೇಷಂಟ್ ಮೋಟರ್ ಮ್ಯಾನಿಫೆಸ್ಟೇಷನ್ ಮಾಡುತ್ತಾನೆ. ಸೊ ಅದಕ್ಕೆ ನಾವು ಸೀಜರ್ಸ್ ಅಂತ ಕರೆಯಲ್ಲ. ಸೀಜರ್ಸ್ ಅಂದ್ರೆ ಜಸ್ಟ್ ಇಟ್ಸ್ ಅನ್ abnormal electrical activity which is occurring in the brain cells, that is called the seizure. Very important. So let me say what is the epilepsy. Epilepsy is, so what I told in previous slide related to seizure, that abnormal electrical activities are occurring more than 2 episodes or recurrently. Okay, more than 2 episodes or recurrent occurring. Very important, recurrent of seizure. Recurrent seizures means the seizures repeatedly occurring, means we call this is an epilepsy. Okay, Very important. What is epilepsy? Epilepsy is a recurrent occurrence of the seizure. That is called epilepsy. Yes. What is the convulsion? Convulsion is a seizure with motor manifestation. Means the patient manifests the motor movement activities when the seizure activities come. That is called convulsion. What is that? Seizure with simple. Seizure with motor manifestation. That is abnormal motor activities, not normal, abnormal motor activities. Okay, let me mention the word abnormal. So seizure with abnormal motor activities means what we call that is a convulsion. Okay, so what is the seizure? Seizure is an just abnormal hypersynchronous, yes, paroxysmal release of abnormal electrical activities in the brain. That is what we call the seizure. And what is the epilepsy? Epilepsy is the recurrence episodes of the seizure we call the epilepsy. And what is the convulsion? Convulsion is seizure activity means due to the abnormal electrical activities which all are coming in the brain. Because of that, there is a motor manifestation. Seizure with motor abnormal motor activities means that is what we call convulsion. Okay, this is the simple difference between the seizure versus epilepsy versus convulsion. So let me differentiate it. This one, but but seizure may occur due to the yes hypoglycemia. Seizure may occur due to the hyponatremia. What is hypoglycemia? Decreased blood glucose level. What is hyponatremia? Yes, hyponatremia is due to decreased serum sodium level and may due to the metabolic abnormalities and due to the abnormal what we call the toxication of the alcohol. So because of that also seizure occurs. Means the seizure may occurring in all those patients where the metabolic values are changing and which all are directly indirectly interrupting the electrical activities of the brain. So it may occurs in the all patient. Why? Because hypoglycemia occurs in all patient, hyponatremia may occurs in you and me also, and metabolic abnormalities due to starvation and all may occurs in you and me also. So seizure may occurs for anyone because of hypoglycemia, hyponatremia, and metabolic. But the epilepsy means seizure which is occurring due to the more than two times means it may be due to the yes the chronic brain irritation means there may be a tumor inside the brain, there may be an abnormal recurrent episodes of the hypoglycemias. So epilepsy will not occur in usual all patients. So seizure may occur in usual all patients. So provocating factors wherever there are all sites there is a chance of occurrence of the seizure. But epilepsy may occur due to the yes the recurrent occurrence of the seizure. And what is the convulsion? Convulsion is the seizure activities with the motor. Okay. So let me differentiate between these three. Very important. Okay. Here is our seizure. Seizure is an simple abnormal electrical activities in brain. Okay. Very. What is epilepsy? Yes. Epilepsy is a recurrent seizure. Simple recurrent occurrence of the seizure. That is what we call the epilepsy. Or a repeated episode of the seizure is called epilepsy. And what is the convulsion? Yes. Convulsion is it is the seizure with motor manifestation. Means abnormal motor activities. That is we call the seizure convulsion. Okay. So the very important difference between the seizure, epilepsy, and convulsion. Okay. Let me tell you about the very important topic that is the status epilepticus. I hope you have studied the word related to status asthmaticus, status epilepticus. What is the status? Status means it's an rapid repetitive occurrence or severe exacerbation of the particular thing. That is what we call the status. Status means it's a rapid repetitive occurrence of the any disease. Means here the status we are adding with the epilepticus means the epilepsy is the recurrent occurrence of the seizure. But the recurrent occurrence of the seizure which is very severe and sudden repetitive occurrence of the epilepsy. So that is what we call the status epilepticus. In order to diagnose the status epilepticus, the seizure or the epilepsy which occurs more than the 5 minutes duration and there is more than one seizure activities in the 5 minutes without returning to the normal level of the consciousness. Means this person went in the yes the seizure activities and repeatedly occur the seizure. That is the call we call that is an yes epilepsy. Epilepsy occurring in such a way that so one epilepsy one another epileptic episode the patient should come to the normal level of the consciousness. But patient not coming to the normal level of the consciousness, another episode of the epilepsy occurs means that is a severe acute exacerbation of the yes this epilepsy. That is what we call the status epilepsy. Status epilepsy means there is more than one episode of seizure in 5 minutes. Okay, more than one episode of the seizure in the 5 minutes, and this seizure occurring and this is occurring without returning to the normal level of the consciousness. That is the very important. That is what we call the status epilepticus. We will discuss each and every treatment part of this in upcoming session. Okay, so in order to understand the seizure versus epilepsy versus convulsion and status epilepticus, you have to remember these points. That is the more than sufficient for your exams. Okay, very important. So let me discuss the simple. What is the causes of the seizure? Seizure may occur due to the yes hypoglycemia, and seizure may occur due to the yes alcohol intoxication, and seizure may occur due to the yes brain tumor, and seizure may occur due to the infections of the brain, that is due to encephalitis, and which may occur due to the yes meningitis also. Wherever there is a brain irritation, there are all the chances of occurrence of the seizure. Okay, and may seizures occurs in the electrolyte imbalance, that is especially in the hyponatremia. There are many causes, and in the pregnancy hypertension with the seizure we call it an eclampsia. So these are the many causes of the occurrence of the seizure. Okay, so let me go for the classification of the seizure and the types of the seizure. Students, so we are discussing the types and classification of the seizure here. See, let me clarify everything first. See, we are having the two brain hemisphere, right hemisphere and left hemisphere. So by connecting right and left hemisphere, there is a nerve fibers that is called as the corpus callosum. Here is the two hemisphere we are having. If the abnormal electrical activities are occurring in one part of the brain, so that is what we call the focal, means in particular area, okay, or partial. If abnormal electrical activities occurring in entire brain, okay, which including the both side of the brain, means generally the abnormal electrical activities are occurring in general, okay, so means in whole part, that is what we call yes general seizure. Okay, very important. Here we are having the two types of the seizure. There is the focal or partial and general seizure. Means if it is including both part of the cerebral hemisphere and which including the both or the entire cerebral cortex, that is what we call the yes the general seizure. If the abnormal electrical activities are originating from any one part of the brain. So that is we call the partial or the focal seizure. Okay. So the very important point you have to understand, in the focal or the partial seizure, we are again having the simple partial seizure and complex partial seizure. In general seizure, we are having the motor seizure and non-motor seizure, means the seizure with motor manifestation and the seizure without motor manifestation. We will discuss in detail. Okay, in for the today's next slides. Okay, so the very important first thing is the focal seizure. We will see. Okay, first I will explain related to the types of the seizure here. Okay, so in focal seizure, we will see the simple and complex in general motor seizures and non-motor seizure. Okay, so in general seizure, we are having the motor seizure. Okay, a motor seizure. In motor seizure, we will study in detail related to generalized tonic-clonic seizure, also called as the grand mal seizure in children's. And tonic seizure, we are having clonic seizure, myoclonic seizure, atonic seizure. We will study in detail. Okay, so and in non-motor seizure, we are having the petit mal seizure, that is the absence seizure. Very important point. So we'll study these each and every seizures in detail now. Okay, so and in yes, focal seizure, we are having the two types of the seizure. I will clarify here the type of the focal seizure. Okay, very important. So focal seizure means, the partial seizure means the abnormal electrical activities are originating from one part of or the particular single part of the brain. So that is what we call the focal seizure. Okay, focal seizure which are occurring in the one particular single part of the brain. So this particular part where I have mentioned with the orange color pen. So this is the a particular site which is releasing the abnormal electrical activity to other part of the brain. That is what we call the focal or the partial seizure. So the one particular surgery we will do here to remove this particular part of the brain. So in order to prevent the abnormal release of the electrical activities, that is the brain ablation surgery. Very important. Brain ablation surgery means we are resecting that particular part, we are removing that particular part, so in order to prevent the abnormal release of the electrical activities. Okay, so let me move for the what are the focal seizure. We are having the two type of the focal seizure. See, the abnormal electrical activities are releasing this brain, so along with that the patient level of consciousness is not altered, means the level of consciousness is normal, only abnormal electrical activities are releasing, means that is what we call the simple partial seizure. Means the patient level of consciousness will be normal and no, there is no any alteration in the behavior of the patient, only there is an abnormal electrical activities which are yes present inside the brain. So that is what we call the simple partial seizure. The abnormal electrical activities which are occurring inside the brain, along with that there is an altered level of consciousness and there is an altered behavior of the patient, so we call that is an complex partial seizure. Only abnormal electrical activities are there, means simple partial seizure. Along with abnormal electrical activity, there is changes in the level of the consciousness and there is changes in the behavior of the patient. We call that is a complex partial seizure. Very, very important. And the drug of choice in partial seizure means the carbamazepine is the yes, carbamazepine is the drug of choice for the or partial or the focal seizure. We will discuss the treatment part in next class. Okay, don't worry. So very important point to understand is the what is the simple seizure and the complex seizure. Simple seizure is an only abnormal electric activity of the brain, and in the complex seizure, along with the abnormal electrical activity, there is changes in the level of the consciousness and behavior. That is what we call yes the complex seizure. Okay. Here is one question for you all. Please answer for the question. Weakness of the body part involved in the seizure activity is known as. This is an yes part we were studied in the our simple or the focal seizures. Okay, so whether we will call this as an aura, aura, what is the aura? Aura means the warning sign. Whether we call this is in Jacksonian march or else Todd's palsy or else amnesia. Students, the weakness of the body part which are involved in the seizure activities is known as not an aura. Aura means the warning signs which will are coming before occurrence of the seizure. So here is the seizure is occurred. After occurring the seizure, the particular part involved in the that seizure activity is got weak. Means it's not an aura. Okay. So we will remove the option aura here. Okay. So the Jacksonian march. What is the Jacksonian march? I will explain what is the Jacksonian march. Here is the what is the amnesia. Amnesia also I will explain. That is the loss of membrane, and we are having the one C option, that is the TORS palsy. Means here is the loss of or the weakness of the body part which are involved in the seizure activities. So what we call that is a TORS palsy. Okay. So let me explain what is the TORS palsy, what is the aura, and what is the yes. So our aura is aura present means the warning signs of the seizure activities are present. Here, the nursing responsibilities goes like to protect the patient. So, when there is a presence of the warning sign, so our first focus is goes to prevent the fall risk injury and protect the patient. And what is the Jacksonian march? What is aura? Aura means simple. It's a warning sign of the seizure. Means where the patient may feel irritable, restless, and patient may have the hallucination of the smell. Like patient will tell, "I am getting the smell of the rose," but there is around surround there is no any rose, but the still patient get the rose smell, and he may get the metallic taste also. So if the presence of that things means it's a warning that the seizure is going to occur. So that is what we call the aura. Okay. So and next point is the Jacksonian march. What is the Jacksonian march? Means the distal to proximal movement of contraction in case of the seizure. What happens? So distal means the dur andre distal, pass andre proximal. From distal to the proximal, there is a contraction of the part which is involved in the seizure. That is what we call the Jacksonian march. Means the contraction starts from here and goes like this. So this is what we call the Jacksonian march, distal to proximal movement of the contraction. So it occurs in the simple partial seizure. Very importantly, Jacksonian march occurs in case of simple partial seizure. Okay, simple partial seizure is the only abnormal electrical activities. Yes, without change in the level of consciousness and without change in the behavior. That is what we call simple partial seizure. So, in the Jacksonian march occurs in the simple partial seizure, means the distal to proximal contraction of the body part that is involved in the seizure activity. That is we call the Jacksonian march. Okay, what is TORS palsy? TORS palsy is yes the weakness of the seizure involved part from the for date from the days to week. Okay. Uh, ಕೆಲವೊಂದು ದಿನಗಳಿಂದ ಕೆಲವೊಂದು ವಾರಗಳವರೆಗೂ ಸೊ ಯಾವ್ದೊಂದು ಪರ್ಟಿಕ್ಯುಲರ್ ಬಾಡಿ ಪಾರ್ಟ್ ಅದು ಸೀಸರ್ ಆಕ್ಟಿವಿಟಿಯಲ್ಲಿ ಇನ್ವಾಲ್ವ್ ಆಗಿರುತ್ತೆ ಆ ಬಾಡಿ ಪಾರ್ಟ್ ವೀಕ್ ಆಗಿಬಿಡುತ್ತೆ ಅದಕ್ಕೆ ನಾವೇನ್ ಹೇಳ್ತೀವಿ ಟಾರ್ಡ್ಸ್ ಪಾಲ್ಸಿ ಅಂತ ಕರಿತೀವಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ವಾಟ್ ಇಸ್ ದ ಟಾರ್ಡ್ಸ್ ಪಾಲ್ಸಿ ಇಸ್ ಅನ್ ವೀಕ್ನೆಸ್ ಆಫ್ ದಿ ಸೀಸರ್ ಇನ್ವಾಲ್ವ್ ಪಾರ್ಟ್ಸ್ ಫ್ರಮ್ ವೀಕ್ಸ್ ಟು ಡೇಸ್ ಟು ವೀಕ್ ಓಕೆ ಸೊ ದಟ್ ಇಸ್ ವಾಟ್ ವಿ ಕಾಲ್ ದ ಟಾರ್ಡ್ಸ್ ಪಾಲ್ಸಿ ಓಕೆ and what is the post ictal confusion post means after ictal means the seizure activities confusion means the confusion. So what all are the thing are the process are the activities which went during the process of seizure? Patient may not remember that one and he is in the state of confusion after the seizure activity. Patient is in the state of confusion after the seizure activities, what we call the post-ictal confusion. Post means after, ictal means surgery, confusion. So after the seizure confusion, what we call the yes the post-ictal confusion. Very important. So here is the question like this. The weakness of the body part that is involved in the seizure activities is known as TORS palsy. Very important question for you. Okay. So yes. So we have studied here. Yes. Partial seizure. We have studied related to simple partial seizure and complex partial seizure. And we have studied related to the yes. What is the TORS palsy? What is the Jacksonian march? And what is the aura? And what is the post-ictal confusion? So let me now discuss related to the generalized seizures. So in general seizure, I have told there is a motor seizure and non-motor seizure. So in motor seizure, the first seizure is the generalized tonic-clonic seizure. And after we are having tonic seizure, clonic seizure, myoclonic seizure, and atonic seizure. So first I will discuss this particular first very important the examiner hot topic, that is the grand mal seizure or the generalized tonic-clonic seizure. The particular seizure which we will induced during the process of the electroconvulsive therapy ECT. So that particular seizure we will study in detail, because this seizure is very important for your examination purpose. So if the many questions, the 90% of the question which will are asked in the seizures are asked on the, yes, the generalized tonic-clonic seizure. Okay, so let me discuss the general seizures here. In general seizure, first we are discussing the generalized tonic-clonic seizure. Means generalized in the sense the entire part of the brain is involved in releasing the abnormal electrical activities. That is what we call the generalized. Tonic means, yes, tonic means there is an increased tone which leads to the stiffness of the muscles, spasticity of the muscles, and rigidity of the muscles. That is what we call the tonic. And what is the clonic? Clonic word in the sense the sudden jerky movements due to the abnormal electricity in the brain. That is what we call the clonic. And seizure is the seizure, that is the abnormal electrical activity. So this generalized tonic-clonic seizure which is occurring in the children's means we call that is the grand mal seizure, and this is the most common type of seizure in emergency room. ಯಾವುದೇ ಹಾಸ್ಪಿಟಲ್ ಕ್ಯಾಸುಲಿಟಿಯಲ್ಲಿ ಆಲ್ಮೋಸ್ಟ್ ಅಲ್ಲಿ ಬರ್ತಕ್ಕಂಥ ಕೇಸ್ಗಳು ಯಾವ ಬರ್ತವೆ, ಜನರಲೈಸ್ tonic clonic seizure. Very important, the most common type of the seizure which comes in the emergency room is, that is the generalized tonic clonic seizure. So if the child comes, that means in the diagnosis we will write that is a grand mal seizure. Okay, so we have the four stages of the generalized tonic seizure. So that first the patient may get the aura, the warning signs of the seizure, and after that there is tonic close and clonic phase, and after that the post-ictal means after the seizure phase. So we will discuss each and every points here. That is very important for the NORCET exam purpose. Okay, so first stage or step of the generalized clonic seizure is the aura, means the warning signs of seizures will come here. If there is presence of the warning signs of the seizure, so our nursing responsibilities goes to shift the patient to the safe place where is a less risk of the fall risk injury. And if the patient is standing in the any corridors or corner, means make the patient to lie on ground. Okay, because if there is in presence of the aura, the warning sign means anytime the seizures can occur. Okay, so what are the signs that helps you to detect the presence of the or the occurrence of the seizure may occur. Okay, so the patient may feel the metallic taste. He will tell without eating anything. He will tell, so in my mouth there is a metallic kind of the taste is coming. If the metallic taste is coming in the patient and without any rose in the surrounding, if the patient telling I am getting the some rose smell, some mogra smell, so and there is unpleasant feelings in the patients, and the patient may sleeplessness or the insomnia, and the patient is getting dizziness, disoriented, means these kinds of these signs symptoms which indicate the possibilities of occurrence of the seizure. Okay, so this indicates this warns the possibilities of the occurrence of the seizure. That is what we call the stage of aura. Okay, so that is the warning sign. Okay, so then step 2 or the stage 2 of the generalized tonic seizure is the tonic stage. Tonic stage, what is the step? Tonic means there is an increase in the muscle tone. So due to increase in the muscle tone, the muscle becomes stiff, tight, rigid, and spastic. Means what is the tightness of the muscle? We call the stiffness, or the rigidity and spasticity, which occurs for the duration of the 10 to 20 seconds. Very, very important to remember for your NORCET exams. Okay, what is the duration of the tonic phase in the generalized clonic phases? Yes, the 10 to 20 seconds. So in grand mal seizure, what is the duration of the tonic phase? 10 to 20 seconds. Very important. Okay, so what is the tonic phase? What are the possibilities? The sign symptom manifestations occurs in the tonic stages: the stiffness, the rigidity, and the, yes, the spasticity of the muscles of the patient. That is the tonic phase. Okay, in the clonic stage, What is the mean of the clonic? Clonic means the abnormal jerky movements like this. So this is what called the clonic stage. The stage in the patient in the stage of the clonic stage. Okay, that is the third stage. So there is abnormal jerky movement of the muscles, and there is a possibilities of the tongue bite, and the perioral cyanosis, and the drooling of the saliva from the mouth, and uprolling of the eyes that are occurring in this one particular patient means that is in the stage of clonic stage of yes the clonic stage of generalized clonic seizure means. So what are the kinds, what are the signs symptoms occur in the clonic stage? Clonic stage, there is an abnormal jerky movements of the muscles. Along with that, tongue bite, possibilities of tongue bite, perioral cyanosis means around surrounding mouth there is a presence of the cyanosis means the bluish discoloration of the surrounding part of the mouth, and the drooling of the saliva from the mouth and uprolling of the eye rolls. That is the indicates the clonic stage of the yes generalized clonic seizure. And we have the post-ictal deficit stage means the fourth stage. Post means after, ictal means the seizure. Deficit stage, what is the deficit? Something losing. That deficit means something like. What is the most common thing the person with seizure may lose his means his memory? That is the patient may feel the amnesia. What is the amnesia? That is the retrograde amnesia. So what all are the thing he had in the previously, that one he will lose. So the memories of previous one is lost. That is the retrograde amnesia. We are losing the ಪ್ಲಾನ್ ವಿಚ್ ವಿ ಮೇಡ್. ಸೊ ನಾವು ನಾಳೆ ಒಂದ್ ಏನೋ ಪ್ಲಾನ್ ಮಾಡಿರ್ತೀವಿ, ನಾವು ನಾಳೆ ಇದು ಓದ್ಬೇಕು ಅದು ಓದ್ಬೇಕು ಎಲ್ಲೋ ಒಂದು ಟೂರ್ ಹೋಗ್ಬೇಕು ಅಂತ ಪ್ಲಾನ್ ಮಾಡಿರ್ತೀವಿ. ಸೊ ಇವತ್ ಸೀಸರ್ ಆದ್ರೆ ನಾಳೆ ಏನ್ ಪ್ಲಾನ್ ಮಾಡಿರ್ತೀವಿ ಅದನ್ನ ನೆನಪು ಹೋದ್ರೆ ನಮ್ಗದು ಎಂಟಿರೋಗ್ರೇಡ್ ಅಮ್ನೇಷಿಯಾ. ಓಕೆ, ರೆಟ್ರೋಗ್ರೇಡ್ ಅಮ್ನೇಷಿಯಾ ಅಂದ್ರೆ ನಾವು ಹಿಂದೆ ಏನಾಗಿರ್ತದೆ. ಸೊ ನಮ್ದು ಲಾಸ್ಟ್ ನಾರ್ಸೆಟ್ ರ್ಯಾಂಕ್ ನೆನಪಾಗುತ್ತೆ. ಓಕೆ, ಸೊ ಲಾಸ್ಟ್ ನಾವು ಏನೋ ಮಿಸ್ಟೇಕ್ಸ್ ಗಳು ಮಾಡಿರ್ತೀವಿ. ಸೊ ಅಂತವೆಲ್ಲ ನೆನಪೋಗುತ್ತೆ, ನಮ್ಗೆ ಪಾಸಿಟಿವ್ನೆಸ್ ಬರುತ್ತೆ. ದಟ್ ಇಸ್ ದ retrograde. Retrograde means whatever the thing had in previously, that one we are going to lose the memory. That is the retrograde amnesia. Anterograde amnesia, what we have planned in future, that is going to last from our memory. That is the anterograde amnesia. Very important point for a NORCET exam. Okay, so patient may sleeps for several hours after occurrence of the generalized clonic seizure. He will go in the deep sleep. Okay, and he is having no idea of the occurrence of the seizure. So seizure ಆಗಿಂದ ರಿಕವರಿ ಆದ್ಮೇಲೆ ನಿಮ್ಗೆ ಕೇಳ್ತೇನೆ ನಾನು ಎಲ್ಲಿದ್ದೀನಿ, ನನಗೆ ಏನಾಗಿದೆ ಅಂತ, because the patient is not aware of the occurrence of the seizure. So the very important point you have to keep in your mind. Okay, so the most common post-ictal deficit is the loss of memory, that is the retrograde amnesia. And so patient may have the no memory of the seizure incident, and the patient sleeps for the several hours after the seizure activity. So the very important point you have to keep in your mind. And the drug of choice for the generalized tonic-clonic seizure is the sodium valproate. Very, very important. You have to keep in your mind. Okay. And we will also give the eptoin, that is the phenytoin. So eptoin and phenytoin, there is an highest risk of side effect of this eptoin and phenytoin. So due to the taking the phenytoin, there is a maximum possibilities of the gum hypertrophy. Yes, the thrombocytopenia, leukocytopenia, and hyperglycemia, and gynecomastia. Hyperglycemia, gynecomastia, gum hypertrophy. You can remember GGG. ಮೂರ್ ಜಿ ಬರುತ್ತೆ. ಗಮ್ ಹೈಪರ್ಟ್ರೋಫಿ, ಗೈನಕೋಮೆಸ್ಟ್ರಿ ಆಗುತ್ತೆ, ಮತ್ತು ಎಸ್ ದ ಹೈಪರ್ಗ್ಲೈಸಿಮಿಯಾ ಆಗುತ್ತೆ. ಮತ್ತು ಒಂದು ಸೈಡ್ ಎಫೆಕ್ಟ್ ಆಫ್ ದಿ ಡ್ರಗ್, ಅಲ್ಲಿ ಹೇರ್ಸ್ ಜಾಸ್ತಿ ಬರೋದು ಇದೆ, ಕಳ್ಕೊಳ್ಳೋದು ಇದೆ. ಎಸ್ ದ ಅಲೋಪೇಸಿಯಾ ಆಲ್ಸೋ ಅಕರ್ಸ್ ಇನ್ ದ ಪೇಷಂಟ್ ವಿತ್ ದಿ phenytoin or the eptoin side effect. And there is an also risk of the yes hirsutism, means the in female the male like hairs will comes in the female body, that is the hirsutism. Okay, so alopecia also occurs, hirsutism also occurs, gum hypertrophy occurs, hyperglycemia occurs, and yes the gynecomastia also occurs in the male. So very important, the side effects of the phenytoin and eptoin we will discuss in the pharmacology classes. Okay, so this is the drug of choice for the generalized tonic-clonic seizure is the sodium valproate. Okay, very important. So this is what we have studied related to generalized tonic-clonic seizure. Okay, let me move for the myoclonic seizure. What is the myoclonic seizure? Here is the word itself indicating it is the myo means the muscle, clonic means the abnormal jerky movements. So without any uh, tonic phase, only there is a muscle abnormal jerky movements without stiffness, means there is only a part of the generalized tonic-clonic seizure. Also we can say the myoclonic seizure, only abnormal jerky movements of the muscles is present, means there is the myoclonic seizure. If the aura present, after that the tonic phase for 10 to 20 second, after that the clonic phase for 30 to 40 second, and as the clonic phase also occurs for the 30 to 40 second, very very important for your NORCET exams. Duration of the clonic phase also seen. Okay. So and after that post-ictal deficit is occurring, means that is the generalized tonic-clonic seizure. And if there is only jerky movements of the muscle, means that we call that is a myoclonic seizure. And if there is no tone, that is atonic seizure, means there is sudden loss of the tone of the muscles, means the muscle become loose, muscle become flaccid. So that is what we call, yes, the drop attack or the akinetic or the atonic, means the loss of muscle tone is occurring. So we call that is an atonic seizure or the drop attack, or akinetic, means the patient is unable to walk, means unable to move. So that is what we call the akinetic seizure. So the highest risk of the fall injury occurs in the patient with the atonic seizure. Okay. So the very important point we have to remember. So one more seizure we are having in the generalized seizures, that is the Salam seizure or the West syndrome, or also we can say this as yes, the infantile spasm. So here the trunk muscle weakness with abnormal hand movement is occurring, means we call that is an Saloom seizure, or yes, the West syndrome or the infantile seizure in infantile spasm, because the mainly seen in the infants. That is what we call the infantile spasm. So you can type in the Google and watch the videos on the Saloom seizure. The very important, the West syndrome also we can see, and the infantile spasm also we can type in the Google. So we'll get the videos of the babies where infants. So where we will be seeing the and for your imaginary and memory purpose, you can see that one in the Google. Okay. The Saloom seizure or the West syndrome you can type, also known as the infantile spasm. So where what happens here means the trunk muscle weakness occurs with the abnormal hand movements. That is what we call the Saloom seizure and West syndrome or infantile spasm. Very important. So these all are the, yes, the motor seizures which are occurring in the generalized seizures. We will study the very very important type of the seizure. So that is our last type of the seizure. So that is the non-motor seizure in the generalized tonic-clonic seizure. Okay. Sorry. In generalized seizure, we are having the non-motor type of the seizure. So that is the absent seizure. So while studying the classification, we have studied, yes, what we have studied here. So in generalized seizure, we have classified into motor seizure and non-motor seizure. We have dealt with the, yes, generalized tonic-clonic seizure, clonic, myoclonic, atonic, tonic, everything we have studied. And we the last type of the seizure, that is the non-motor seizure, means there is no any motor manifestation. So that seizure we are going to study now. That is our, yes, very important type of the seizure. That is the non-motor seizure. Okay. In the non-motor seizure, there is only one type of the seizure, that is what we call the absence seizure. ಬಹಳ ಇಂಪಾರ್ಟೆಂಟ್ ಇದೆ, ರಿಮೆಂಬರ್ ಮಾಡ್ಕೊಳ್ಳಿ. It's the non-motor seizure. So the word itself saying it's a non-motor, means there is no any motor manifestation. And the word absence seizure is itself saying is the period of the absence is there. It's the period of the vacant staring spell, means the patient, see, one child is playing volleyball or else any ball in the ground, he will stand, suddenly he will stand, and he will not respond to his surroundings, but his level of consciousness is normal, and he will not fall down also, there is no any motor abnormalities. Only a 1 to 2 second there is a vacant staring spell, means the sudden blank look appearance, he look like blank like this, and after he will do what are the activities he is doing. So suddenly he is doing activity and stop, and again start. So this is what we call the vacant, means the khali space. So that is the what we call vacant staring spell and the blank look appearance or the seizure which looks like in daydreaming. Very important point. One liners may arise directly here. So the seizure which looks like in daydreaming is an absence seizure. Here the normal muscle movement is there, the normal posture control is there. Muscle movement is or the muscle tone in the absence seizure is the normal, and the posture control in the absence seizure is the normal. So there is a least risk of the fall injury in the absence seizure, and the no postictal deficit or the no postictal confusion means the after seizure there is a loss of the memory, so nothing will happen in this absence seizure, and self recovery occurs after the 20 years of the life of the as the particular patient. And the drug of choice for the absence seizure is the ethosuximide is the drug of choice for the absence seizure. Very important. Okay, you have to remember. So this is what we have studied the all classification of the seizure. Okay. So we are having the other types of the seizure. So let me explain in short. So what is the febrile seizure? Febrile seizure means due to the increased body temperature. So there is an occurrence of the seizure due to the increased body temperature means that we what we call the so febrile seizure. So most commonly in children occurs the febrile seizure, but generalized tonic-clonic seizure is the most common type of the overall seizure, and in children also which occurs most commonly due to the increased body temperature. The most common seizure what we call the is the febrile seizure. So the treatment of the febrile seizure comes like this: we will give the paracetamol to decrease the body temperature along with that rectal diazepam in order to control the seizure activities. And in recently we have updated the medicines, that is the intranasal midazolam is the drug of choice for the along with the yes PCM. Why we will give the rectal diazepam here? Why not oral diazepam? Because there is a patient in the episode of the seizure, there is an abnormal electrical activity in the brain. If you are giving something orally means there is a highest risk of the aspiration. So we avoid the oral route in the patient with the seizure, and we will ask the patient not to have anything during the episode of the seizure, and we will educate the parents of the child very importantly not to have the not to have anything orally during the episode of the seizure, because in some villages if the any seizure activities occurring means the some parents will try to put some water in the mouth, and they try to uh, inside the hand inside the mouth of the baby, so it may damages their teeth and the tongue also. So will education of the child parent is very important. Okay, we will discuss in the next slide what all are the education. So what is the nursing responsibilities in the patient with the seizure. Okay, so we have dealt here with the febrile seizure. Febrile seizure is the seizure that occurs due to the increased body temperature, that is what we call the febrile seizure. So the treatment of the febrile seizure is the paracetamol. Yes, with rectal diazepam, and the intranasal midazolam we will give. The paracetamol we will give intravenously, and the diazepam we will give as the rectally. And intranasal midazolam spray also we can use for the treatment of the febrile seizure. And the most common seizure is examiner asking means the most common seizures which occurs in the neonate means that is the subtle seizure. If the examiner is asking most common epilepsy in neonates means that is the benign Rolandic epilepsy. What is that? BRE, that is the benign Rolandic epilepsy is the most common epilepsy in the neonate, and most common, yes, the seizure in the neonate means that is the subtle seizure. Very importantly, you have to keep in your mind. Okay. So in the absence seizure, we are having the two types of the absence seizure. That is the typical absence and atypical absence. Simply, you have to differentiate between the typical and atypical. So in typical absence seizure, what I told regarding the absence seizure, there is a vacant staring spells, the seizure with the daydreaming appearance, or the muscle activity tone is normal and the body posture is the normal. So only the patient will shows the vacant staring spell or the daydreaming or blank look appearance. That is the what we call the as the absence seizure. That is the most seen in the children's between the age group of the yes the uh, 6 month to yes to the year of the 6 year. So and the self recovery occurs completely after the 20 years. Okay, so in typical seizures, level of the conscious may means the vacant staring spells will be alter for only 1 to 2 seconds. In atypical, it may goes for the more than 10 seconds. When we do the electrical and electroencephalography, that is the investigation of choice for our seizures. So we will see the 2 to 4 hertz of spikes with the wave pattern. And in the atypical seizure, we will get the electroencephalography diagnosis less than 2.5 hertz spike with the wave pattern. That is the differentiate between the typical and atypical seizure. Very important. Okay. So here is the diagnosis. First, we will rule out the cause of the seizure because the seizure may occur due to the hypoglycemia. So, if first the patient coming to the emergency department means first we will try to check his blood glucose level. That is very important, and it may occur due to the hyponatremia, metabolic abnormalities, hyperthermia also. So, first we will try to rule out the cause, and we will send the patient for electroencephalography. That is the investigation of choice. So, electroencephalography is yes, the study of electrical activity of the brain. Very important. What is the EEG? Study of electrical activity of brain. So that is what we call the yes, the electroencephalography. Very important. So what is the ECG? ECG is the electrocardiography. We are studying the electrical activities of the heart. That is called ECG. So in the phase of the graph, this is also will come in the graph, and video assisted EEG also there in today's updated version. Okay, so very important. EEG is the investigation of choice for the yes, the seizure. So if the seizures EEG is got normal means we will go for the yes, the brain MRI brain. Okay, or the CT brain is the we will go for that one. The very important is the investigation of choices for seizure is electroencephalography. Okay, where we are studying the electrical activity of the brain. So in next class, in next session, we will study the management of the seizure, where we will studying the all nursing management, what we will do, how we will maintain the airway, how we will what all are the nursing responsibilities which are very important, and we will study the medications which all are as a drug of choice for the subtle seizure and drug of choice for the yes, for our generalized tonic-clonic seizure, and for the each and every type of the seizure, we will study medical management, and very importantly, the 60% of the questions which comes from the seizure is the nursing management of the seizure. So we will study the nursing management of the seizure in the part 2 of the yes, our seizure topic. Okay, so thanks for watching the video. If the video found informative to you, please share the video to your groups and friends, and do subscribe to my channel. To subscribe my channel, please click over the logo which are coming at the your corner of the video, blue color one. You have to click on that, and the subscribe button will come. You have to click on the subscribe button, so you will get subscribed to my channel. Thank you so much for watching the video.